Imagine this. A once bustling clinic in the heart of Harlem now echoes with silence. The absence of patients more telling than any medical diagnosis. This is the stark reality that Dr. Chanel Diaz, a primary care physician deeply rooted in immigrant health, has been witnessing for months. Her undocumented patients, who once depended on safety net programs like NYC Care and hospital charity care, have mysteriously vanished. They've just gone off the map, she laments, her voice heavy with concern. But here's where it gets controversial. Is this a mere blip in the system, or a chilling indicator of a deeper, more sinister trend? Let's dive in and explore the unsettling truth behind this vanishing act. The story of NYC Care, a lifeline for the uninsured, has taken a troubling turn. Launched in 2019, this program was designed to provide health access to New Yorkers ineligible for insurance, including undocumented residents. For the first time since its inception, enrollment in NYC Care has declined. While NYC Health and Hospitals officials attribute this dip to aging participants transitioning to Medicaid, public health experts paint a more alarming picture. They warn that this decline could be a direct result of the Trump administration's aggressive deportation policies, which have instilled a deep-seated fear in the immigrant community. The program's rapid growth, from 24,500 enrollees in FY 2020 to over 143,000 by 2024, seemed unstoppable. But according to data obtained from NYCHH, enrollment dropped in the third quarter of fiscal year 2025 to 141,129 members, down from 143,503 at the end of FY 2024. Though the decline is relatively small, it marks the first downward shift in a program that had been steadily expanding, even amid a historic influx of asylum seekers. Nick City Health and Hospitals officials insist that the drop is largely due to undocumented residents age 65 and over becoming eligible for Medicaid, and thus ending enrollment in NYC Care. But former City Health Commissioner Dr. Oxiris Barbeau isn't buying it. She points to the Trump administration's targeting of immigrants and their rights as a likely culprit. We've been concerned about the chilling effect on help-seeking behavior that anti-immigrant rhetoric is having, she warns. People are scared. And this is the part most people miss. The fear is palpable, and it's driving undocumented immigrants away from the very care they need. Dr. Carolina Miranda, a family physician who has worked in the South Bronx for 8 years, has seen this fear firsthand. Her patients, many of whom are immigrants, asylum seekers, or experiencing homelessness, are terrified. We've seen a very significant drop, she says, her voice tinged with sadness. In one shelter, which was designated a sanctuary shelter for migrants, the patient volume declined so sharply that we stopped going there because almost no one was showing up for care. The reasons behind this drop are as heartbreaking as they are infuriating. Many patients have stopped seeking care out of fear of immigration and customs enforcement, ICE raids, or arrests. People are afraid to leave their homes, Miranda explains. Some tell me they canceled appointments because an app alerted them that ICE was in their neighborhood. Others are hesitant to engage with formal medical systems that keep records, worrying it could jeopardize their immigration status. Former Mayor Bill de Blasio launched NYC Care as part of his failed presidential campaign, guaranteeing access to care for uninsured New Yorkers, particularly undocumented immigrants, excluded from Medicaid and other public programs. City officials stress that NYC Care is not insurance, but a membership in a network of services provided by NYC Health Plus hospitals, with costs calculated on a sliding scale. Having membership in NYC Care is about connecting people to high-quality primary care, says Barbat. It's not sporadic sick care. It's about prevention, coordinated services, and referrals to specialists when needed. That's both humane and cost-effective. But the fear doesn't stop at the clinic doors. Recent federal policies, such as the revelation that the Centers for Medicare and Medicaid Services, CMS, shared personal data with ICE, have only deepened the mistrust. The Associated Press reported that CMS agreed to give 79 million enrollees information to the Department of Homeland Security, including home addresses and ethnicities. Under the de Blasio administration, City Hall explicitly refused to share immigrant data with federal authorities. The Adams administration says it also does not share information with immigration officials unless the person has been accused of committing a crime. We're not allowed to collaborate for civil enforcement, period, the mayor has stated. But Barbo believes more needs to be done to reassure the immigrant community. It would be very helpful if the city publicly reinforced that it won't share data, she says. That was certainly the position when the program launched. But now more than ever, people need reassurance. The stakes are high, and the consequences are far-reaching. If funding for caring for undocumented immigrants disappears, it's only a matter of time before services for all New Yorkers start taking a hit. For those who end up uninsured because of policy changes, NYC Care is one of the only lifelines they have left, Barbo warns. Hospital officials insist they do not share information with ICE. NYC Health plus hospitals does not maintain records or track the immigration status of patients seeking care, says agency spokesperson Alex Hunter. We only release patient information with your consent, or if authorized or required to do so by law. But the confusion and fear persist, according to Barbot and other medical professionals. They point to broader cuts at the state and federal levels, including restrictions to New York's essential plan and looming Medicaid work requirements as compounding factors. These changes could cause many low-income residents, including immigrants, to lose coverage entirely. Many people mistake NYC Care for traditional health insurance. Others don't know it exists. And for some, fear of government surveillance or deportation prevents them from signing up altogether. This program needs to be advertised again, aggressively. Barbot urges, the city needs to make it crystal clear that NYC Care is safe, private, and here to help. Some of that fear has long existed in immigrant communities and predates the Trump election. But Barbot says the current climate has pushed it to a fever pitch. Diaz, who practices at Columbia University Irving Medical Center and has served nearly a decade as a medical evaluator for people seeking asylum, has seen the consequences firsthand. The recent federal cuts, combined with escalating fear, are driving this silent exodus, she says. And for many undocumented New Yorkers, the stakes are life and death. During Trump's first term, one of her former patients, an undocumented man with long untreated diabetes, ended up in the hospital with a severe foot infection that had spread to the bone. He needed an amputation, Diaz recalls, her voice heavy with emotion. And he was terrified. He'd been in this country working for 40 years. He said, I've been paying taxes for 40 years. Are you telling me I can't get any help? It was heartbreaking. It's not just new asylum seekers who are avoiding leaving their homes to seek medical care, she adds. Legal permanent residents, people with visas, they're all worried. The chilling effect of these moves is already being felt, according to Diaz and other doctors focusing on the immigrant community. In the past, we could say confidently that your information is confidential, that it wouldn't be used against you, Diaz says. I can't say that anymore. The consequences go beyond a few missed appointments. We're seeing the consequences in real time, Diaz warns. People end up in the ER with strokes, with complications from diabetes, things that could have been managed with routine care if they had known where to go or had felt safe enough to go. In the Bronx, Miranda emphasizes that the decline predates but worsened significantly after the Trump election. This fear is more explicit and severe than before, she says. Even when people remain in shelters, they avoid coming downstairs to the clinic because they're nervous about being documented or stopped. Many patients delay specialist appointments they've waited months for, and some send their American citizen children to pick up medications to avoid exposure themselves, she adds. Miranda has turned to virtual appointments to reach patients reluctant to leave home. Though the shift is limited by patients, access to technology, and comfort with remote care, she also collaborates with medical legal partnerships to help patients prepare for contingencies, such as possible deportations, including sessions on legal guardianship for children. It's heartbreaking when patients tell me, "I skipped my specialist appointment because I was scared ICE was nearby," she says. I try to reassure them, but the anxiety and mental health burden are overwhelming. Sometimes the conversations go deeper than just medical advice, she notes. A colleague who specializes in pediatric care has repeatedly been asked if they'd be willing to adopt the patient's children if they get detained by ICE, according to Miranda. Some patients are also worried about starting new treatments, she adds. I have a patient who is a transgender man who is afraid to pursue gender-affirming care because he worries about being deported, despite his legal status given his pending asylum case, she says. He's afraid that if he is forced to return to his birth country and has noticeable changes like facial hair and a deeper voice, he will no longer be able to pass as the gender he was assigned at birth, and this would be dangerous for him. And the nature of her job has shifted since the Trump election. Before, I didn't have to talk about know your rights or deportation fears at every visit. Now it's a constant part of the conversation. So, what do you think? Is this a temporary blip or a sign of a deeper, more systemic issue? Do you believe that the fear of deportation is driving undocumented immigrants away from the care they need? Or is there more to the story? Share your thoughts in the comments below, and let's spark a conversation about this pressing issue.